Hello, let's discuss the median nerve. Okay, so median nerve is one of the terminal branch of the brachial plexus. It originates from the brachial plexus by two roots. One is lateral root. This is lateral root of the median nerve, and this one is medial root. So the lateral root is comes from the lateral cord of the brachial plexus, while the medial root comes from the medial cord of the brachial plexus. So the medial and the lateral root combine to form the median nerve, and then the median nerve supplies most of the muscles of the forearm and some of the muscles of the hand. So in the arm there is no branch of the median nerve. It supplies the muscles interior compartment of the forearm and some of the muscles of the hand. Okay, so the about the landmarks of the median nerve. So median nerve, this is median nerve. Okay, so this one is median nerve, and median nerve in the cubital fossa. Okay, so this region is cubital fossa, and in the cubital fossa the median nerve is the most medial structure. Okay, the most medial structure in the cubital fossa is median nerve, and in the after passing from the cubital fossa, it enters into the forearm between the by passing between the two heads of the pronator teres. This is the deep head of the pronator teres, and this one is the superficial head. Sorry, this one is the superficial head, while this one is deep head of the pronator teres. So it passes between the two heads of the pronator teres to enter into the forearm region. So this muscle is the median nerve, and it enters into the hand by passing deep to the flexor retinaculum. So this structure is flexor retinaculum, and the median nerve passes deep to the flexor retinaculum, and before passing into the flexor retinaculum it gives one superficial branch, which is this one. This is palmar cutaneous branch of the median nerve, which supplies the skin of the palm. Okay, so this is about the landmarks of the median nerve. Okay, in the forearm it passes between the two heads of pronator teres to enter the forearm, while in the hand it enters the hand by passing deep to the flexor retinaculum. Now the supply or distribution of the median nerve. The median nerve supplies all the muscles in the interior compartment of the forearm except the 1.5 muscle. Okay, 1.5 muscle is supplied by the ulnar nerve, while the all other muscles of the interior forearm, which is the flexor compartment, so they are innervated by the median nerve. Okay, so the flexor carpi ulnaris and flexor medial half of the flexor digitorum profundus, these muscles are supplied by the ulnar nerve, while the all the other muscles are supplied by the median nerve. While in the hand it supplies the thenar eminence muscles, okay, which are opponens pollicis, abductor pollicis brevis, and flexor pollicis brevis, and the lateral two lumbricals are the first and second lumbrical. So this is the supply of the muscular supply of the median nerve in the hand. Okay, most of the muscles of the hand are innervated by the ulnar nerve except the thenar muscles and the first and second lumbricals. While the cutaneous supply of the hand, it supplies the lateral two-third of the palm. Okay, lateral two-third of the palm and lateral 3.5 fingers. Okay, the of the on the palmar side. So on the palmar surface or on the interior surface of the hand. It supplies two-thirds of the palm, okay, skin of the two-thirds of the palm, and lateral 3.5 fingers. Okay, so these are the cutaneous supply of the median nerve on the palmar side of the hand, while on the dorsal side it only supplies the lateral 3.5 fingers, only the distal fingers, okay, or the distal phalanx. Okay, so the distal phalanx of the 3.5 lateral fingers on the dorsal surface. Okay, so this is the dorsal surface, these are the distal phalanx. 3.5 distal phalanx are supplied by the median nerve. These are the cutaneous supply. Okay, so this is all about the median nerve. Thank you.